they can feel it coming on and they get so anxious because the pain is that intense. Most of you have heard of brain freeze headache. How many people have had a nice brain freeze headache? Well, the understanding is it's like that, only it's lasting. Okay, so much so that the eye will tear. Okay, it peaks, and fortunately, it doesn't last all that long. But the really interesting thing about it is they come. That's why they call cluster headaches. They will come very peculiarly at certain time necessarily of the day and the year. People can sometimes set their clock by them, and they may get them every day at a certain time, and then they'll just kind of go away. It might take a week, a month. I had a patient who was happening pretty much from springtime all the way to the end of the summer. He'd get them most days. If you started a medication and all of a sudden you're getting more persistent headaches than you normally would, or if you didn't get them and you're getting them more than just an occasional, it could be that the drug is the problem. Doesn't mean you go off it. It means you talk with your physician. Change a medication, alter a dose, or most probably if the medication is something that's necessary for you to function and do well with, to make sure we listen to what we're talking about in the next several minutes about the triggers to minimize those. Okay, then there's the quick fixes that we all want to get rid of the pain, right? And many live on quick fix medication, but there is a problem that I want to make you aware of. We have mild to moderate headaches. Most of us use over-the-counter type of stuff. Most of the time they don't cause something called rebound headache, and they are okay for quick fix as long as it's not frequent. What's that? I would say that if you are using these type of things more than one to a couple times a month, that it's too frequent. And even then, you should be looking to find out what the cause of the headache is, and if there's anything you do to manage that, even better. And then we got, for severe headaches, many have heard of the triptans, and they generally work very well. However, they are a bear when it comes to rebound headaches, and it's kind of like a vicious cycle, and we'll talk about that. Here's what's going on with quick fix dilemma. It works by creating a constriction and a reduction of inflammation of those blood vessels that are expanded, and you get marked relief. And that's good, but what winds up happening, particularly if they're frequently used, the body will rebound in the vasodilation and the inflammation, not to where it was when you had the headache, but almost double that. So here you are, you have a headache, you take your quick fix, and it constricts, and it will constrict and help reduce the inflammation. When it wears off, it can double up, and we can get more pain. And it's a vicious cycle that's very difficult to get out of, and understandably. But we want to work hard to look at those lifestyle factors so we can, over time, hopefully, minimize the utilization of those medications. Thresholds versus triggers. Your threshold to headache is typically determined by multiple factors, and the genes are not discounted, okay? Part of it may be genetic tendency. Example of threshold-lowering factors are chronic poor posture, shoulder, neck, and head region. Trigger is typically a physical, chemical, emotional, lifestyle factor that one is sensitive to the extent that it contributes to the overall trigger burden of the headache. It's the addition or the accumulation of all the triggers at a given point in time of a day or a part of a day which has you cross your threshold into headache zone. Say your threshold is up to here in your head and we are filling it up with triggers. And this is why it can get confusing. You can say, sometimes I eat chocolate or I drink wine and I get a headache. Sometimes I have that and some cheese and I don't get a headache. I don't know what the story is. Most of the time these are common triggers. The issue is that on any given day or point in time in that day, the overall burden of trigger that you were exposed to didn't go past the threshold. Say it's a beautiful day with the barometric pressure right, your hormone cycle is on even keel right now, there's not a lot of other stresses going on, which is rare, but let's say that's the case. And you had not so good lunch with some things in it that would typically you would think would be a problem. You never got up to this level, so it didn't create a headache. Okay. But on another day, you had all those other factors going against you. And you didn't even eat as much chocolate or drink as much wine. But it sent you over the top. The further over you go, over your threshold, the more migrainous process will be created. What's that mean? Generally worse headache and possibly more associated symptoms. So the idea is to raise this line and minimize the triggers. We've identified many common triggers. These are common, difficult to avoid triggers. Heat and humidity, change in barometric pressure, okay? Approaching storms. I mean, it's difficult to avoid. What are you going to do? Fly out of state or, change your geographic location that quickly when a headache's coming on. So that's why I call them difficult to avoid. Ongoing, protracted, chronic stress that we really feel doomed by. So it certainly pays for us to identify, have better ways to relate and manage those problems for ourselves as part of managing headache. Dietary triggers always come up, and certainly it's an area you want to investigate well. These are very common dietary triggers. If you are dealing regularly with headache and it's real problematic in your life, take a strong look and probably look to eliminate pretty much all of them. Not easy. Many times when patients come in with headache and we do our review and all our questionnaires, we will put them on a detoxification diet, eliminating all this stuff and some other things. So it's strict for a week, and then there's some reintroductory of foods, and we start to look. And we're also looking at a tracker, a diet, and a lifestyle tracker that includes how they're doing with their headache. I don't know how many of you guys, because of the, wanting to lose weight and the whole no fat, no sugar, go ahead and eat a lot of artificial sweeteners. But most of them are problematic, and not just for headache's sake. Okay? I'm strongly going to encourage you to find another way to manage your sweet tooth, see if you can dampen it a little bit. Okay? But get off of that stuff. Use it. I say sparingly, but the reality is I'd rather have you not use it at all, and just use a little bit of raw sugar, because the idea is to not have such a sweet tooth. So if we're going to lower the sweet tooth, then we just need a little bit of sugar. We don't need chemistry. That's the best idea. Skipping meals because of its effect on blood sugar. Those of you guys that are, skipping breakfast and then a light lunch, you're really disrupting metabolic function, hormonal balance, sugar regulation in the blood. It's problematic. And I know it's, you get up, well, I'm not hungry. It's part of the telltale sign that you're metabolically damaged. If you wake up after sleeping all night and you're still not hungry, maybe you have some nighttime eating or binging thing and you've shifted this whole thing. We should wake up and within an hour be hungry. That's how natural hormones in our body will set things forth to get the metabolism going and become energized. If that's not happening, even without pain and symptoms, it's a sign to you that your body is out of rhythm, it's out of sync. There are others. Perfumes, visual strain. Some of you are looking for your spouse's name on there. Checkbook. It's about relating to some things differently in life too, not eliminating them. How do we improve our threshold? The main areas that we have seen with threshold revolve around mechanical and muscle joint problems of the neck, posture, jaw, being deconditioned. And we do some hormone balancing in the office. Sinus problems as it relates possibly to dietary effects on sinuses, sinus drainage. We do some acupressure and lymphatic drainage that are manual techniques that help people. Acupressure techniques through the head, face, and neck. Posture is a big one, guys. It's how we are holding ourselves literally 24 hours a day. It's not just at your workstation, but it's when you're relaxing at home. It's positions you get in when you sleep. All of those areas can be part of your demise if they're in bad alignment. And quite frankly, the head and the shoulders need to be more upright. Even when we lie down, we should be in better alignment and balance. So we have pillows and beds that are supportive and keep us in better alignment. If we're sleeping on our stomach with our head twisted, we're going to continue to create uneven stresses and strains that could be part of why the neck, shoulder area into the jaw have too much tension in them. And each little area, builds upon the other to create a burden of too much tension and stress. How many of us are just totally out of shape? Can't oxygenate tissue well. You don't utilize blood sugar as well when you're out of shape. We can go on and on about what goes on in our body physically when we're out of shape and the impact that has on our health overall. Not to mention, just plain old feeling good and oxygenating our brain. In our clinic, a foundation of our approach revolves around what we call the triad of health. Chemical way, the way we think, and the structural physical way we're dealing with and using our bodies. So when we consult with an individual, we like to step back and see all the different areas as it relates to anything from headaches to back pain to heart disease. And how can we contribute within that triad of health to teach a person and maybe have therapies as well designed to bring someone back to a greater state of health, create awareness, have them have their responsibilities and things they need to do. None of this happens without wanting to make change, like anything else. The commitment's, here and here, and then you take action on it.